Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning. Welcome to Open Your Eyes, Start Your Morning Right. I'm Marlene Cuellar, and thank you for joining me this morning. It is a lovely Tuesday morning, definitely a beautiful day to be outdoors. It is sunny, it is breezy, it is everything we look forward to in March. And it does mean as well that it's dried up a bit because we had a few showers over the past few days. And we'll be finding out just what our weather is going to look like in just a few so you can plan your day accordingly. In fact, I do know we have our forecaster on the line, Ronald Gordon. Good morning.
Hi, good morning. Well,
oh, sorry, Crystal. See, I thought it was Ronald. But good morning, and let me just start off by saying happy Meteorology Day today.
Thank you.
All right. So we want to say from all of us here at Channel 5, of course, happy Met Day to all of you. I know you're a very hardworking, small team. We have Shania Young there. We have Michelle. There is Angelia. And there you are. And last up, we should have Ronald. And I know that we don't have in those photos Catherine Cumberbatch or Francisca. But good morning to all of you and your team, and we really wanted to take a moment to say Happy Met Day.
Oh, thank you so much.
All right, Crystal, so let's get started and talk about what we can expect for today.
Okay, mainly spot clear and warm conditions will prevail for the next few days.
Okay, and the 24-hour forecast?
Skies will become mostly sunny today and clear to partly cloudy tonight with little or no rainfall expected.
Okay. And those winds, the March winds are back.
Yes, they are.
Ah.
So winds over the open sea will be from the east to southeast at 10 to 20 knots and sea conditions will be choppy. And just to note, a small cross caution will likely go into effect tonight as winds become gusty and seas may be rough at times.
All right. Very critical update there. But what about our temperatures?
Okay, so the highs for today will reach around 87 degrees Fahrenheit along the coast, 93 inland, and 78 in the mountains.
Mm-hmm. And for tonight?
Tonight will be 79 along the coast, 70 inland, and 66 in the hills.
Okay. And what about the next few days? Is it going to continue to be like this?
Yes, it's going to be nice, fair, pretty weather for the next few days.
Oh, all right. I hope it sticks around for the next few weeks. All right, Crystal. Well, thank you so much for that update. And what's the celebration like for you guys there at the Met Service?
Well, it's just business as normal, but everyone can look out for little tidbits on our Facebook page.
Well, as I said, Crystal, one of the things I'm always fascinated by is how small the team is and all the work that you manage to produce on a daily basis. So thank you and to the rest of the team for all that you do.
Well, from the National Met Service of Belize, we give you a warm thanks as well.
All right. Have a great day.
You as well.
Okay. All right, and there you have it. Beautiful March weather. It's going to be warm, but it's going to be windy, and most importantly, it's going to be dry. We do want the operators of small crafts to know, or small boats that is, that tonight there will be a warning in effect because of the wind, so please take that into consideration as you schedule your day. And so we're going to keep things moving with our eye opener for today, and that means a bit of motivation to get you going. Our eye opener is taken from dailyom.com, and it goes like this. Maintaining healthy boundaries is about recognizing the point at which our principles and those of our loved ones no longer overlap. As relationships evolve, lives gradually become entwined. We tend to have a great deal in common with the people who attract us, and our regard for them compels us to trust their judgment. While our lives may seem to run together so smoothly that the line dividing them cannot be seen, we remain separate beings. To disregard these barriers is to sacrifice independence. It is our respect for the fact that our lives exist independently of the lives of others that allows us to set emotional and physical boundaries to explore our interests and capabilities, even when people close to us do not understand our partialities, and to agree to disagree. The healthy barriers that tell you where you end and the people around you begin will give you the freedom to pursue your development apart from those whose approval you might otherwise be tempted to seek out. Others will continue to play a role in your existence, but their values will not direct its course, and the relationships you share will remain marvelously balanced and harmonious as a result. All right, that's a big one for today. I feel like I need Jenny here to be able to really drive this point home. Something that I know a lot of us can struggle with, and it oftentimes in maintaining or even setting boundaries, the hardest, or in doing so, the hardest situation to do so is with those that you care about the most deeply. And that's with your immediate family, of course, those you grow up with, and close friends. For some reason, we are very tempted to feel that we don't need to have separation in what we tend to do. We want the buy-in from the family. You want the approval of the loved ones. And many times you end up stifling what you actually want to go after because you are settling for what everybody else wants you to do. Being able to recognize that you have a need to set boundaries for yourself is one of the most important things that you can do in your own journey of self-development and awareness. And if you recognize that you're in a position where you feel like you're just doing what you should do, what everybody expects you to do, then that means you are probably at the mercy of not having set proper boundaries. So take the time to reflect. It is a journey. It is a practice, in fact. You have to keep on doing it and be comfortable with the fact that it's going to be a bit challenging when people don't accept it, but keep on going because it's what is best for you. All right, so that is our eye-opener for today. And today is actually March 23rd, and it is officially the 1-year anniversary of Belize having reported its first case of COVID-19. Back then, we didn't call it COVID-19. Back then, we only knew it as the novel coronavirus. And while the rest of the world had, in fact, initiated their first wave, we had just been waiting for what we knew would eventually come. The novel coronavirus was detected. It was actually detected, we know now, from the end of 2019. However, the world came alert to it in early January, in the first few weeks of January. And it's fascinating to think back now of how it rapidly spread across the globe. And it was officially declared a pandemic in the middle of March. And at the end, we saw that around that time, we saw where moves were being made in Belize to try our best to be able to prevent the entry of the disease. And however, on March 23rd, we did in fact have the day where the first case was confirmed. Today we're going to be talking all about the pandemic. We're going to take a look back. This has been an absolutely historic time for all of us. And all of us have had a different experience, whether you've just been trying to keep things afloat in your life, in meeting your responsibilities, whether you battled COVID, whether your loved one battled COVID, whether you lost a loved one to COVID. There's so many different people, so many different stories, and we hope to be able to share some of those with you today. But to put it all into context, let's travel back to March 23rd, 2020. And this was when the first case was confirmed in Belize.
Belize is already feeling the devastating effects of COVID-19, and with the first confirmed case, the country's economy is expected to suffer greatly. The first confirmed case was reported in La Isla Bonita, San Pedro Town, and Burgess Key, Belize's top tourist destination. The government declared a state of emergency on the island. No one goes in and no one leaves. After the announcement was made, residents quickly packed up and headed to the water taxi terminals with the intention to arrive on the mainland. Flights were grounded. Tropic Air announced the suspension of flights to and from Burgess Key. The water taxi terminals in Belize City were shut down, and 2 ocean ferry vessels filled with passengers from Keycaulker village were prohibited from docking at the Brown Sugar water taxi terminal in Belize City. After 2.5 hours, the passengers were allowed to disembark, after which they were screened and sprayed with disinfectant. Outside the ocean ferry terminal, Keycaulker villagers were up in arms after they were not being allowed to travel to Keycaulker. Meanwhile, in San Pedro Town, panic and fear is real.
There is a sense of fear and panic right now, that I cannot lie about that. No, people are just messaging me, calling me, and I keep on repeating the same thing that we were saying this morning on the radio, to remain calm. I know there was a little bit of rush at the boat and at the flight, but I understand those who has been cancelled for a while, and see what happens from there. But pretty much it doesn't make sense that you be rushing, and I think I want to reach out again to remain calm. And the reason is that if we are here in Burgess Key, we don't know who this person is, where that person may have been around, we don't know. So it's best for us to remain here. I think we're safer here to be staying here and not to go back to our homes. You know, we have that risk, that inherent risk that that you don't want to do that. So that is my pitch to you all, people who want to leave. It's best that we stay here. Nothing to be frightened about. It's to remain calm.
But the people of San Pedro Town are asking what will happen next. There's a sense of uncertainty lingering on the island.
There is a sense of uncertainty of what will happen. Like, persons that have lost their jobs and persons that were planning to leave the island so that they could be free of paying rent and paying other bills while being laid off. That is a part of the community that is at the moment, like, somehow trying to get answers from local authorities of what will happen to them. So there is a sense of tranquility, and also there is some ambience of frustration.
Very unpleasant
and that
duty.
frustration is building. Pictures show of boat passengers attempting to dock at a pier along the seaside. They were stopped by police officers. Any vessel that approaches the mainland is stopped by law enforcement officers. San Pedro Town has been on lockdown.
Quarantine, isolation, whichever term you want to use. But we are unable to do that if we don't get the cooperation of the public. I know that after we made the announcement, there were lots of people that were simply just wanting to get off the island. It doesn't mean also that everybody who was in San Pedro is automatically at risk. It doesn't mean that automatically you need to come off the island, and that's not the due process then.
With employment in the tourism sector already taking a deep dive, a confirmed COVID-19 case on the island is expected to force San Pedranos to change their daily routine, stay home, stay calm, and take preventive measures to prevent the spread of the deadly disease. More than 1,000 employees who work in the hotel industry are jobless tonight. That number is expected to increase as the tourism industry continues to take a hit. Reporting for News 5, Hipólito Novello.
I have the very unpleasant duty of announcing this morning that we have our first confirmed case of a Belizean citizen having tested positive for COVID-19. The person is a Belizean citizen, but goes back and forth between our country and the US, came into Belize from Los Angeles on Thursday, as I understand it, had already started feeling unwell, and so went straight into self-isolation.
The first confirmed case of novel coronavirus was recorded in San Pedro by the Ministry of Health today. After several weeks of closely monitoring the spread of the pandemic within the region, Belize now joins over 190 countries that are affected by COVID-19.
We have identified the case. She has been in self-isolation. She doesn't require, at this point in time, hospitalization, which means we are not going to bring her to the facility. She is self-isolated home. Being told this morning she's actually improving. Her family members that are in the immediate contact will be screened, as is the process, and we do mapping exercise in terms of who she may have been in contact with in her before she actually got to San Pedro.
Health authorities have commenced contact tracing via the individual's travel history in order to determine who the patient may have also exposed to the virus while en route to Ambergris Caye. A state of emergency has also been declared on the island. This will allow for the ministry to conduct the exercise properly.
While we don't know for sure, and while the full tracing and mapping exercise will be done, it does seem as though there was very minimal contact with anyone except for the physician that attended the person at the private clinic she visited, and that physician was properly protected.
The initial case was confirmed at about 10:45 p.m. on Sunday, after health officials had conducted 11 tests, including the one in San Pedro that has returned positive.
We have 11 swabs done yesterday. The only one that came back positive is the one that we are confirming today. Just one other thing in terms of screening. When you are taken for screening, you will do a first test. If that is reactive, then you have a confirmatory test done. So both of them would have turned out to be positive before we can actually come back to you and say we have a confirmed case.
Along with this confirmation comes restrictions that government has already begun to implement for residents and non-residents of San Pedro in an effort to mitigate the spread of the virus.
There are things we're going to be doing to ensure that, in fact, that is going to happen. The principal message, apart from making the announcement I just did, the principal message I want to send out this morning is this. We, I repeat, must take this thing extremely seriously. But we mustn't overreact and we mustn't panic.
But residents of the island town have done quite the opposite. Immediately following the Prime Minister's televised announcement, there were snaking queues at the water taxi terminals as many attempted to flee the location.
We're asking San Pedranos to, as it were, shelter in place. We know that there are people, today is the last day for the international flights, and we know that there are people who are coming in from the island to try to actually get out of the country. So we're not enforcing, as from today, any kind of quarantine with respect to the island, but we're asking San Pedranos not to come to the mainland except it is absolutely essential, and we're asking mainlanders not to go to San Pedro except it is absolutely essential. We will give some thought to whether, in fact, we need to impose a quarantine. If we do, after further consultation with the medical personnel, it would only be for something like 48 hours. That is the kind of time frame that they need to do as comprehensive a mapping exercise as possible.
2 health teams have since been dispatched to San Pedro to assist with the timely mapping of all persons who potentially came into contact with the 38-year-old woman. As is required by international standards, the Ministry of Health has proceeded to inform the World Health Organization as well as the Pan American Health Organization.
I will have to go and set up the template report for WHO and PAHO as a first confirmed case. We are going to label it as an imported case because the travel history, the 10 days prior to her arrival here, is exclusively in the U.S.
Reporting for News 5, I am Isani Cayetano.
Hard to believe that was a year ago. I think, there's so many different emotions and memories that flash back when you hear the seriousness with which the news was delivered, and being able to see how far we've come since then. I mean, just let's look at the vocabulary and the focus that early on. We were talking about the processes of contact tracing. We were talking about whether it was an imported case or a close contact case or a community spread case. And that early on, we knew so little about the disease that there was just a whole lot of fear that manifested when we did detect the case in country. Looking back now, I'm sure that one of the things that people can recollect is just the level of discrimination that also popped up when there was a positive case, how people would react at that time. And it's interesting when you put it into perspective now as to how we are, I wouldn't say comfortable, but a bit more aware as to the risks associated with being COVID-19 positive. So that was March 23rd, 2020, and here we are, March 23rd, 2021. Very different reality, still living in a pandemic, still have quite a few of the changements and adjustments that were to come. Back then in March 2020, there was still a debate over mask use. That was one of the things that was really interesting. At first they said, save it for healthcare workers. Then they say, well, you may touch it too much and contaminate yourself. And then it eventually became a general mask mandate that it was one of the best ways to protect ourselves, in addition to washing our hands, of course, and social distancing. Social distancing itself changed over time. We went from 3 feet to 6 feet. Now, in other parts of the world, they're examining how much space is actually needed to reduce the possible transmission. But it is hard to believe. As I said, it is our 1-year anniversary, and that's what our show will be focused on today. Yeah, good morning.
Yeah, good morning.
Yeah, I do want to make a note just to say that there is a News 5 special report that we're putting together. It's called From Panic to Pandemic, COVID-19 a year later. Our news team have been working on putting together just the history-making year that we've had from March 2020 to today. And you will be able to see that on Thursday night at 8 p.m. And I guarantee you it will be fascinating to look back at how far we have come in just 1 year.
Oh yeah, absolutely.
Yeah.
I mean, like all of us, I think I can remember a year ago today when there was so much panic, as the bumper says.
Mm-hmm.
And I mean, one of the things that I always remember is very early on, probably into the lockdown, when everything was closed except for hospitals, supermarkets, and whatever. And I remember my mom had just gone to the supermarket, and she and my sister, like when they came home, they were like on our front step, like just furiously cleaning everything with Lysol.
Yeah.
And I just remember thinking at the time, like, I can't believe what we're going through right now. Like, it was such a strange thing for life to have come to such a standstill.
Yeah.
And then everybody was still in this fear mode. Everybody was nervous of being around people. Everybody was nervous of touching things. And to a certain extent, that still does apply. But compared to where we were in March and April of last year, it's completely different.
Yeah. Absolutely. I think my moment of, wow, we're living in a pandemic was definitely in the lockdown phase. Mm-hmm. We were still coming to work as a part of essential workers, and driving through the streets and seeing no one is such an ominous, it's just, it's jarring. You see, I literally think I took moments, if I saw one car in a distance, I was like breaking my neck to see who's that and where they're going, especially if it wasn't a police truck, because you saw no one on the way to work. And that was for the period of time where the entire country was just on a rigid lockdown. Mm-hmm. And I don't think that's something that I will ever be able to remove from my memory. And I'll always know that that was just kind of the moment where you realize that this thing is serious. And look at how it's completely changed our lives.
Yeah, absolutely.
Yeah.
And, you know, sort of probably on a more, or in a more positive vein, I can remember when they first set of, when they had first started to ease some of the restrictions a little bit. And even though I wasn't, you know, going into, you know, my office or anything, I was still just coming here. But one of the things that really struck me the first morning that they had lifted some of the restrictions was the amount of people who came out to exercise. And, and that number was steadily grew throughout the pandemic. And, you know, I think it's kind of still growing. But one, I mean, I thought it was good that people were going out and they wanted to be active and healthy, you know. But what also it showed to me, or what struck me about it was, you know, just this sense of wanting to be outside and people, you know, wanting to perhaps, you know, even if it was with, yeah, for the most part I would imagine it was restricted to, you know, to their households or whatever, but just to be outside, to see other people maybe, you know, safely of course with, you know, keeping their distance or whatever, but I still remember that sort of being a strange thing to see people once more.
Learning not to hug people.
Oh yeah.
Yeah, that was, you had those moments where you met people very early on and you're like,
that still happens.
You know, I actually think it's gotten easier now, but it's yeah, we've been through so much together, and as I said, today we're going to be talking to a number of people. We're going to be talking to people who survived COVID. That's a critical story that we need to talk about. People who either had to battle it along with family members. Some were hospitalized and were able to be released. So our first conversation and the bulk of our show today is going to be talking to people who survived COVID-19. And then we're going to take a moment to talk to some of the frontline specialists in the medical community and find out from their perspective. Remember, they were the ones who were thrown into these COVID-19 units to be able to tackle a disease that no one knew how to treat, that there were all these different signs. You know, first they thought it was a respiratory illness, it would only affect the lungs, and they realized it was systemic. So there's so much to be able to discuss today, looking back at COVID, and it's the first reported case in Belize since 2020. As of yesterday, there were a total of 12,407 confirmed cases in the country over the span of a year. Currently, we only have 52 active cases, and of course, we must not forget, and we must never forget, that during the course of this first year of the pandemic, we lost 316 Belizeans to this disease.
Yeah, absolutely. And our hearts, of course, go out to all the families and the loved ones of those who have lost people as a response to the pandemic. Of course, it's very unfortunate, and that's why it's so important to continue to practice all of the safety measures, because, you know, we might want to think that because the numbers are down or anything, we can relax a little bit. But if we are relaxed, I mean, think about the domino effect of the, you know, the consequences that our actions can have. You know, we're still, I mean, since the beginning of the pandemic, I think one of the most striking features of COVID-19, and one of the scariest ones to me, is the amount of asymptomatic and cases or cases with very mild symptoms, where, you know, people may be walking around and, you know, because they feel all right, even if even if they practice the safety measures, we know that they're not, you know, 100%, you know, effective. So, you know, you may come into contact with somebody who doesn't even know that they have it. So that's why you have to be, you have to still be extra vigilant and think about, you know, the fact that, you know, if you do pass it on to people, you know, they may be living with others who are, you know, much more susceptible than you. And that's been the message from the beginning of the pandemic, and it's one that we always have to keep conscious of.
Of course, and we have seen time and time again where even young people can be severely affected. So, you know, you may think you're safe, but that's not always the case. On the flip side, though, if we're looking at numbers, we are officially, as of yesterday, 16,000 Belizeans have been vaccinated with their first dose of AstraZeneca vaccine. That's a growing number as well. That's the number we want to see growing more than the actual confirmed cases. And definitely a really I mean, when you think of detecting the first case, we knew nothing about it, to here we are at vaccination rollout.
Yeah.
It's just, it's worlds apart from how we feel. But we're going to get into our show today. As I said, our first panel for this morning is we're going to be talking to a group of persons who survived COVID-19. They're going to tell us all about their stories, the challenges, the health scares, and even some of the residual effects that they're still facing. That's the focus for this morning. And then we talk to the medical community. We're talking to frontline specialists, those who also had the task of getting into units to work with patients where they knew so little about the disease and how much we now know today. So that's what we have in store. We're going to go ahead and take that break. And when we come back, we'll be joined by a group of people who survived COVID-19.
It's a fact that you can access unlimited services with Smart. Tired of being measured or cut off when you need to be connected? It's a fact that when you sign up for Smart's Plus plan, you get unlimited talk, text, and unlimited data. And it's a fact that you can sign up with your group of up to 5 members for Smart's Share plans and up to 40 members for Smart's Enterprise plans for unlimited talk, text, and data. Smart has the true unlimited plans. That's a fact. Be smart and live smart.
In these challenging times, the one thing that is certain is that the Belize Bank Limited is here for you. There is nothing more important than your health and safety, and we continue to make every effort to make banking safer for you. Our staff is working around the clock to make sure you can do your banking conveniently 24/7 using our mobile banking app and online banking and keeping ATMs up and running. We value your relationship with us and are here to provide the support you need. First responders are also out there 24/7. Thank you, healthcare workers, security forces, firefighters, caregivers. You are all appreciated. Stay safe. We will get through this together. The Belize Bank, our country, your bank.
Want to leave a lasting impact when you travel? Then travel locally. Make memories to treasure for a lifetime while making a difference. Make protected areas your next travel destination. With over 25 protected areas under the APAMO umbrella, the possibilities for adventure and education are endless. You can bond with friends and family while trekking through the jungles to discover natural pools and breathtaking views. Or take that snorkeling trip to the magnificent world of coral gardens and marine life. Then camp under the stars to end off that perfect day in nature. By visiting protected areas, you are helping to preserve wild places and biodiversity. You're building local communities and you're keeping our natural and cultural heritage alive. You have that power. Travel locally and make an impact. We invite you to visit a protected area near you and discover the beauty of Belize's wild places. APAMO, the voice of Belize's protected areas.
It's been a year of lockdowns, losses, and separation from loved ones. As life slowly begins to return to normal, Channel 5 invites you and your family to join us on TV, Facebook, or YouTube for a News 5 special report from panic to pandemic, COVID-19 a year later. We look back at the people, the events, and the struggle Belizeans will never forget. Thursday, March 25th at 8 p.m. right here on Channel 5.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we are back, and as we said earlier, today is the official 1-year anniversary since Belize reported its first case of COVID-19. And to take a look back as to how far we've come, we decided to hear from COVID-19 survivors themselves. So we have 4 guests with us. We have Rolando Montero, we have Wilema Alamia Gonzalez, we have Honorable Jorge Spat, and we have Ingrid Vega. Good morning.
Good morning. Good morning.
Well, thank you so much for joining us this morning, and we appreciate you being willing to share your story with us. Just let's start off with your reflection, looking at what it feels like to be 1 year after we first started to battle this pandemic. What comes to mind for you?
Well, I can start. What comes to mind is being thankful. Being thankful, I celebrate today not the pandemic, but I celebrate life. You know, and I celebrate that our numbers are less. I celebrate that Belize now is in the session of the vaccination. So I celebrate that we are more likely to be in a so-called, we're going to soon be and hopefully soon be in a normal state as what we used to call it. So that's what I want to say a whole year later after this pandemic, because I really don't want to celebrate the pandemic, but celebrate life, because we're here and thankfully we're here to talk to you about it.
And go ahead.
The same for me. I am very, very grateful that I'm alive. And for me, it's more like an appreciation of life and an appreciation of everything. This pandemic and the illness, COVID-19, taught me to not take for granted a lot of things. Not take for granted even being able to just be able to breathe, it was an experience where you were aware of every little thing that every day you do and how challenging it was to live a normal life with the virus. Like it was, at some points it was difficult to walk, to sleep. So I have a great appreciation of everything in my life. This is like a second opportunity for me, and I'm grateful for that.
This year has been a very challenging year for Belize, for many families who have lost their loved ones. In the world, it's been very challenging too. At the beginning, we didn't know what the COVID-19 was, but a lot of people, a lot of researchers, a lot of doctors have put a lot of effort in trying to combat this disease. And we need to thank all the health workers, all the frontline people that have gone out of their way, have sacrificed their lives, their families, to see how best they could challenge this disease. So it is a reflection of what has been going on. You hear in the Bible about diseases, but we never take these things seriously until it happens to you. So I am very grateful too to be here and talk about my experience. You never think that this could happen to you. You always think positive. Oh no, this will never happen to you. I used to tell my friends, wear no mask, social distance, wash your hands. But I believed that it could happen to me. And on the 11th of December, my brother-in-law called me and told me, you know what, Rolly, I just tested positive for COVID, and you were with me over the weekend. I would recommend for you to go and do your test. I stayed quiet for a little while. Then I told him, okay, I'm heading to Belmopan to do my rapid test. And I went to Belmopan and it came back positive. So I immediately called my family and informed them. Traveled back to San Ignacio and did my stayed at home, no, for a couple of days. And from there, things started deteriorate. No, I started with a.
Your family your family tested positive as well. Your immediate family, the wife, the kids.
Yes, my wife and kids went to do their test the following day, no, because it was a late afternoon, no.
Yeah, Rolando, you have a really interesting story, and I want to get back to it in just a few. But let me just get Honorable Espat's reaction to the 1 year anniversary.
Good morning, Marlene. Good morning, Gavin. Good morning, Belize. For me, I wouldn't really like to state celebration of COVID-19 for the first year. It's a sad story for many of us. We have had family members, we have had friends, fellow Belizeans. We had lost one of our colleagues in our political career. It's very hard to say. I would rather like to say that I would rather like to say that I am thankful for all of us that God have given us a second opportunity to be present here today to continue our day-to-day life. Thank to all the efforts of the medical workers, to all those that created the medicines for the cure or to try to stabilize our health back to normal. It's a sad case. I've been through it, and I wouldn't wish that upon no one, especially the expenses, putting the burden on the families and the risk as well. So I would like to rather state I would be thankful for the second opportunity that our good Lord gave us to be here present today.
Yeah. Now let's talk about your COVID story, and Rolando, we can go back to you so you can tell us a bit more. You tested positive in December, and so there'd been some time already. There was this huge spike in September. Tell us a bit of how worried or the fear, if you had any fears at that time.
When I tested positive, I didn't feel no fear. I said I will get over this. It will take me probably a couple of days because I had talked to some friends and they said the most it's 2 weeks. So I had a positive mind that within a couple of days I'll be back at work. And I will continue to live my normal life now. Unfortunately, that was not the case. Over the weekend, I started deteriorating. No, I didn't want to, according to my wife, I didn't want to go out from the room, just lie in bed all day, don't want to do no exercise. That was over the weekend. On Wednesday, my brother-in-law, again, since he had tested positive, he had to be rushed to the polyclinic, no? And his oxygen level was about 87. So my sister-in-law called my wife and told her, you know what, I think you should check Rolly's oxygen level because Rick is at 87. So they tested my one and my one was at 82. So I was immediately rushed to the San Ignacio Polyclinic, where they administered some oxygen. And during that time, my wife started making some calls. She called my niece who's a doctor too, and she told her, you know what, you need to move Rolly immediately to Belize City. because at 87 he could only deteriorate now. So they managed to get an ambulance and take me to Belize Medical Associates. That was on Wednesday. I didn't recall much. On my way to Belize, all I could recall was the paramedics asked me if they could pray for me, and I told them, yes, go ahead. And from there, I don't remember much. When I went into the hospital in Belize, you know, from there, my memory, I think I was deteriorating health-wise.
Did you feel as bad as the emergency, as how they were treating you? Did you feel?
Pardon me?
Did you feel as bad as all the emergency care that you were receiving? Because you said you only did the oxygen saturation test, and that kind of triggered all these things.
Yes. Yeah, during that time, I only had a cold and cough. I don't recall any pain in my body and no other pains. But I think mentally I was deteriorating, and I didn't realize it now because I couldn't recall several things that transpired during to the Wednesday that I got to Belize City. From there, I think Dr. Coyard took over, and I think by the 16th, I was health-wise, I had deteriorated that he had to intubate me, I think about midnight from what the stories they are telling me, And I think I spent about 6 days in intubation, And I think they started bringing me back, what was the 24th of December, sometime 24th of December to the 25th in the morning, which was Christmas Day, When I got up, I was completely lost. I didn't know where I was. Wow. At one spell, I think I had hallucinations that I thought I was in a hospital in the US now. I didn't ask because I was confused, depressed. That morning, my wife went to see me, and I think my spirits came back now, and then she told me where I was, and had good care at Belize Medical Associates. They used to check my oxygen level, my temperature every half an hour, and it was a long process.
Wow.
I was confused last.
Yeah. To go from feeling perfectly fine to in a hospital and then eventually intubated.
During that time, you don't know. So till after I came back, the only thing I could remember before I was intubated was the Dr. Coyer told me that. Yes, I remember clearly. He said, "Rolly, I'm intubating you, but I promise that I will bring you alive," and that gave me hope.
Yeah.
And
that's a scary.
From there, until they wake me up sometime around the 24th at night, and then transpired over the few days. And then I stayed there until December the 28th. Now, when he said they did all the necessary tests, and he told me you're good to go home and rest.
But
during those.
Rolando, during that time, when we still think about it, and I know Ingrid has a similar experience, so I'll get her to share that too. When you hear intubated in Belize, which means, mechanical ventilation to help you breathe, especially at that time, it was a very concerning moment in treatment. So when you're told by your doctors that this is something that has to be done, what goes through your mind?
Honestly, Marlene, I don't remember.
Yeah.
If he spoke with me about intubated me, up to today, I don't. All I remember was he told me, "I will bring you alive."
And that was your comfort.
How my wife and my kids felt when they got the call, that they go to, because at that time there was, I think, only Mrs. Vega had survived intubation.
Yeah.
So it was, I think, it was a very scary experience for them. But honestly, Marlene, I don't remember.
Yeah.
I don't remember anything. If probably Dr. Correa had a discussion with me, but I don't have a memory of that.
And Ingrid, do you want to?
Yeah, I understand what Mr. Rolando has been saying. You tend to not remember what's happening. You're like in a state of shock, And at that moment, I have just gotten the news that my husband passed away. So I was like, oh, okay, but before that, when you're hearing people getting intubated, the first thing that comes to your mind is like, oh my gosh, that's it. Like you've never heard anyone getting back from this intubation. So that's the first thing you tend to think about. But at the moment when they told me that I had to be intubated, I think I was in a state of shock, I would say. I can't remember. I just kept on thinking that I need to get back to my girls. That's all I had in my mind, So, yeah, it can be. And then after that, you don't remember what happens next.
Wow.
And at that point, how are you physically feeling, if you can remember, in terms of the actual symptoms that you were experiencing?
Well, like I wasn't feeling too bad. Like it just happened so quickly. And at that point, my sister would be the one telling me bits and pieces. And she told me that when they called her, I had the opportunity to talk to her. Wow. And she said, yes, I was having a hard time breathing. It was difficult for me to breathe. I was like, but I didn't feel any pain or anything. I can just remember they telling me I need to be intubated and that my saturation was not good at all. So they really didn't give me figures. I can't tell you where my saturation was because I think they didn't even want to tell me how my saturation was at that time. So they told me that it was not, I needed to be intubated.
Yeah.
But I didn't feel any pain or anything. It was just a difficult breathing.
Yeah. And Jorge, you also had to be hospitalized for a period of time, right?
That's right. I was in for 6 days.
Yeah.
Actually, it was a very bad feeling. Being alone in a room, monitored by a camera. And we had the nurses from time to time in their suits just come in to administer the medication and write out again. I was admitted on Sunday evening, actually, and I was released on Saturday evening. For those 6 days, I was in bed face down, a very, very bad experience. All the lines, oxygen, drips, the oxygen control level sensor everything was placed on me. Actually, the monitoring of the blood pressure as well. So imagine being hooked on to all of those lines, lying face down, nowhere to go for 6 days.
Yeah.
And I got concerned, I believe it was on Wednesday, when they changed the oxygen system on me. And the response was that the system was changed so that oxygen can reach to my lungs. And that's where I started to get a bit concerned. Knowing that if that didn't work, that it meant intubation for me.
Wow.
Thankfully, I believe I was the first one being administered the remdesivir. It was in the country. I do not know for what reason it was not accepted by the previous administration. I made sure it got out, and I was the first one that started to, the first candidate for it to be administered on. So I got in on Sunday, and by Saturday I was out. Those were 5 doses administered. As I mentioned, it was a very sad feeling, not having your family around, not knowing from the outer world. I mean, you being locked on that 4 walls there, all alone.
Did that also make you nervous in terms of being one of the first to receive that course of treatment?
Yes and no, because at that time you want something to make sure that you get out of the loop of the risk involved, knowing that there had been a lot of people at the time that had been in the criteria that passed away, you know. For certain and for sure, I didn't want to be on that list. So at any cost, I was looking for a better treatment. I was in Healthcare Partners. My son got diagnosed on Saturday. I recall I was in Color Creek looking at the flood victims at that day, and by Sunday morning, I started with a high fever. That's when I went along with my other son to get tested, and we both came back positive. And by Sunday evening, I was admitted at the hospital right away. You know, my oxygen levels were at 87, I believe. And from there, it started deteriorating, 82, 84. So I was concerned.
Of course, yeah. Willamette, let's hear your experience too. You had the added concern of having family members who were high risk being positive at the same time as you. Tell us your COVID story.
Yes, Marlene, my story is a little different than the rest of the panelists. I didn't go to the hospital, so I was blessed. I didn't get to go to the hospital and I wasn't hospitalized, and I was very lucky. My story is a little different in that when we found out that we had that we were infected, it was a family that was infected. We were all feeling well. My dad kept complaining about an allergy, but he kept working. He is a fisherman and he was out fishing every day, and he did complain about that he was tired and he had a little cough, and he kept saying that it's just an allergy, that every year, and rightfully so, every year around that time he comes down with allergies. And excuse me, let me just get this.
Yeah. Somebody else is trying to talk to you at the same time.
It was the radio in my office. I apologize. So anyway, he kept getting worse, and we are in San Pedro, so we went to BMA at Grand Caribe, and they did the rapid test. Because we were all there. Well, not all, but like it was my mother, my father, my son, and then myself. Now, my father is 76, my mom is 70. My son has chronic ulcerative colitis, which it's an immunodisease, and his immune system was compromised. He was taking immunosuppressants. He's under a medication called Humira too, and everyone at home was being super cautious because we didn't know if that my son would survive it if he got it, and that was our biggest concern. So really none of us went out, just my dad. He was the one in charge of grocery shopping, of getting all the essentials, and my dad was extra careful. Like, we had, like, everything at home was regimented. Like, we would go, my dad would be the one to go shopping. He would, when he come home, he would change, he would shower, like everything would go like at a place where it would be disinfected, like all the groceries and everything. We took extreme care. So when I kept telling my dad to go get tested, but he could not, I think that he couldn't accept that there was a possibility that he get it, because he was extra cautious. When we did go to get tested, 4 of us, my daughter also lives with me, and somehow she did not get it.
Wow.
Go ahead.
I was going to say, just, so when you finally get the positive results and your son is high risk, your dad is high risk, what's it like? Because you still have to ensure that you're taking care of yourself, but, there's just this predominant fear.
Well, I honestly, like, the best way I can describe it is, I found out when I read the results and I saw that my son Rudy was positive, I honestly felt that my heart stopped, because all this time, like, everyone is telling me, take care of Rudy, because if he gets it, he might not make it. But it turned out that because of the medications he was taking, later on we learned that Humira, which is a medication that he takes for the disease, that is an anti-inflammatory biological agent, and so that helped him. Afterwards, I heard that they were using that type of medication to help COVID patients because it brought down the inflammation. So my son, like, he did struggle, but he was the one that had it, like, he was the one that got it mild. My dad, on the other hand, he started getting worse. He started getting worse, and he was hospitalized for 12 days at Belize Health Partners, and I'm very grateful, because he said, up to today, he keeps saying, like, I'm alive because the doctors there fought for me. I remember Christmas Day, and it was the most depressing day in my life, because, so first of all, you're dealing with your symptoms, because I did have, I did not get a fever, but I had horrible headaches, my eyes hurt, I had pain in my joints and fatigue. Like, I had extreme exhaustion. Like, I just felt like I could just sleep and sleep for days. I had chills, cold sweats. One of the things that I don't think we forget, or we don't talk about, is the mental distress that comes with all of it too. Because, like, I remember somehow someone telling me, just remember that the 8 and to the 14 days are the worst days. So I remember waking up every day, and I'm like, I would breathe, and I'm like, okay, I'm not dreaming, I'm alive. Like, it was so scary, like, just the uncertainty.
And how do you factor in that fear that you have for your own self, but then your dad's in the hospital, and that's part of the perspective that Rolando, Ingrid, and Jorge, they don't know, because they were hospitalized. But what was it like to be the family member on the outside, knowing your loved one is getting treated?
It was, like I said, one of the most horrible experiences that I've had. Exactly because of that. Like, it was terrible that we knew that Dad had to go, and none of us were allowed to go. We were still infected with COVID, and even after we we were negative, we still weren't allowed to be with my dad. And just like they were mentioning, that we knew that my dad was alone, that and it all happened around Christmas time.
Yeah.
When we got to video chat with him, you could see like how deteriorated he was. And for Christmas Day, Marlene, we got a call from Dr. Hidalgo, who said that they have my dad in observation, and if by 6 o'clock, and if by 6 o'clock he does not respond to the treatment, they would have to induce coma. And it was just devastating. It was devastating. I saw my mom crying. My children are like very nervous. My father is the patriarch of our family. He's the one that's always held us strong. He's the one that's always like, and when he tells you his story, he was in the hospital worried about his family. Like
wow. Yeah, natural. It's naturally what you do. And you know, I think, Ingrid, you mentioned that before, that your survival, and I always remember your story, it was all about being able to go home to your girls. You knew that you had lost your husband, you were battling the disease, it was getting serious, you had to be intubated, and the one thing that kept you going was knowing that you had to go home to your girls.
Yeah, you know, and I think it was a sort of motivation to keep on fighting, you know, because I always tell myself that if I'm here and God gave me an opportunity for a new life, then I can't give up. We need to keep on fighting, you know. And I'm sure that what Willema is saying about her family being outside and her dad being in the hospital, not knowing what will happen, I'm sure that's what my family went through with me. Yeah. So and yes, I have to agree with Willema, it's a mental thing. You gotta be strong, you know, and you gotta put yourself in your mind, because I just told my family just the other day that it is a mental thing, because when I was in the hospital, I set my mind that I can't grieve my husband, and I didn't, because I had to fight. I had to be better. I had to get better. And I told myself I'm going to grieve him when I get better. And now that I'm no oxygen, I am back at work 2 weeks now. I am getting better. Now the grieving started. So it's a mental thing, you know, like your mind controls you. So yeah, it does affect you. You gotta be strong and you gotta keep on fighting.
Ingrid, every time you say that statement, it gives me chills. When you say that you delay the grief until you know you can handle it, or because you knew survival was most important. And I know that this is still something that is very raw for you, but you know, we lost 316 people in this pandemic. We can't forget that. As much as we talk about vaccines and recoveries and curfews, people lost loved ones. You know, just in being able to pick up the pieces, the rapid deterioration that took place, the fact that you were handling your own illness. How are you doing with that today?
Like I said, Marlene, I am grieving now. It's hard, but I keep on praying every day for strength, you know, and my girls are something that I go and look forward every morning and every night after work, every evening after work. That's something I look forward every day, to see them at home. So I keep on fighting every day. It's not easy. And, you know, we gotta keep on telling ourselves that the virus is still out there, and we gotta keep on being careful, because I won't wish this for anyone. And like you said, we lost 316 people, and it's sad. Now that I went through it, then I think about those other 300 people and their families, because it's not only me, and I'm sure that all these other families are having a hard time, you know, because they all had wives, they all had moms and dads and kids.
Yeah.
So they're all going through the same thing that I am going through. So it's not easy. It's not easy, but God gives me strength every day.
Yeah. And going from and we can get the rest to comment on this. Going from the fears, I know, Jorge, you spoke of it, the fear that you have while you're in the hospital. You know how serious the illness is. You know there's the potential risk for death. You know that you hear the stories of just this rapid deterioration that may take place. What was your tactic, Jorge? Let's get you and then Rolando to talk about how mentally you got yourself through this time. Isolation, concerns that you're ill, how bad it could get.
Arlene, on my case, being the head of the family, my wife as well, I was very, very, very concerned because she was admitted actually in Friday as well. And then that put us both in the hospital, leaving our family out, our business. So we left the business in the care of our boys. They were running the business actually, and we were actually hospitalized and very concerned in the case of my wife because she's a diabetic as well. And then luckily I was I got out Saturday. She was admitted Friday. So I was out of the hospital, and at least I came back home still under quarantine, but still yet concerned about the well-being of my wife being at the hospital. So it's a very sad situation, very concerned.
He's freezing up there, Rolando. Let's hear your point of view. How you were able to kind of.
As your being, you want the best to happen at the end of the day.
Yeah. Rolando.
Yes, I agree with Mrs. Vega and with Selma. Mentally, it takes a drain on you. You have to think positive because all kind of things go through your mind. You feel depressed, isolated, but fortunately, there comes the support of your family, your friends, and give you that positive, that you think positive, and all the power of prayer. Every day, my family, friends used to pray for me. I didn't believe in prayers, but after what the doctor told me, you know what, Rolly, I gave you up now. And miraculously, you are here. You have to thank God. You have to thank all those people that prayed for you. Because when I had called your wife, I told her that I can't do anything else for you. And over the period of that day, said, my wife called the family and gave them the bad news. They started praying, they called friends and they prayed all day. And miraculously, the doctor said in the afternoon, I started responding now. So I believe that God has a purpose for all of us now. And for those non-believers, the power of prayer and the power of having family support, friends that will encourage you to get over that depression that you go through. It is difficult to explain it, Marlene, if you don't go through this sickness. I know Mrs. Vega could attest to what I'm saying now, but being alone in a room, not knowing what will be the next day, and the same thing I used to do. For me, it was difficult because I couldn't sleep for nights. After came out from intubation. It took me at least 6 weeks to get back to that rhythm. So for days and nights, I couldn't sleep. So it was very challenging for me mentally, physically. But the good part is that I had a good appetite, and that brought back my spirit, because I was like a baby. I couldn't do almost anything for myself when I came back from the hospital. So, and I'm a very active person. I go out to work every day, and being at home, not being able to do anything for myself was very challenging. But the courage of my family, my friends that used to call me and tell me, Role, you need to be strong, you need to be there for your family. And that's how I overcame it, Marlene. But if you don't go through that experience, it's difficult for people to conceptualize what you are telling them.
Yeah, you're right. I can't imagine. I can't imagine what it feels like, the isolation, the fear of getting sicker. But let's bring the conversation forward. You know, I want to hear from you what that feeling was like, all of you. Willema, when it happened for your dad, and for you, Ingrid, for you, Jorge, and for you, Rolando. When you found out you were going home, when you knew you had beat COVID, you were one of the survivors, and not just one who survived asymptomatic, but one who survived severe illness. What was that feeling like?
Well, for me, Marlene, I was thankful, first of all, to God for the second opportunity, knowing that I was coming out of the hospital alive and not in a casket. I was thankful for the second opportunity, and to the doctors for the attention, Dr. Hidalgo, Dr. Arriaga, Dr. Potts, and the other doctors there around. It was, I was so happy to know that I was going back home in a way, but leaving my wife in the next room.
Yeah.
You know.
So that's bittersweet for you.
That's right. That's right. Yeah. But actually, that was part of it. Then knowing that
I think the video froze again. So, Willema, share your experience when you knew your dad.
Then I had insomnia. I had the cough. I had stomach problems. I had back pain. You know, and the doctor told me, you know what, it's going to take its own course. 3 to 4 months. I said, what? I cannot afford that. I'm not that type of person to be staying at home. You know, I'm that active person.
Yeah. Those are the long-term effects that you said, the things you had after you came out?
Yes, I suffered. The worst thing was the insomnia. I couldn't sleep. You know, and then I had the cough. That was the second worst effect. Yeah. I had to be on the nebulizing machine. Yeah. Like if I had asthma, I started to cough, like the asthma attacks, and the back pain because of the lung that was infected. You know, the stomach problem. It's like what Mr. Montero said or mentioned. We were back at like a young baby, trying to get adjusted back to our normal lives.
So let's go back to Willema, and you tell us about what it felt like when you found out your dad was going to be released from the hospital.
Marlene, it was a bittersweet feeling, and the reason I said that is because we were extremely happy that he was at a point where he could stay home. But once he came to us and we saw how he was getting to San Pedro, I was scared. I was scared because I saw that my father was still very fragile. He was still on oxygen, and I started like, I was scared because I didn't know that, I wasn't sure that we could take care of him the way the hospital was taking care of him, and he didn't look good. Just like Mr. Montero, Mr. Honorable Espat, and Ingrid say, like, it was like they were starting from zero. Like, it was a recovery from zero. And even today, Marlene, my dad is someone that he's up early in the morning and he never stops. Like, he never stops. He's still bed bounded. He still haven't recovered completely. And his recovery is very slow. And with that, even though he knows he's home, even though he's better, even though things are every day it's a better day, I have to tell you that since our family experienced COVID, nothing has been the same for any of us. Nothing. Like, I used to jog 4 miles every day. I can't even walk 4 miles now. And that depresses you and it frustrates you. And then other elements come in, like depression, like stress, because we don't know, like, up to now, we don't know if we're going to recover fully. Like, and some days we're doing well, other days we can't get out of bed. And it's one day it's my mom, one day it's me, one day it's that. Well, that is the one that's constant. Like, the other day he tried to walk, and you know, San Pedro's blocks are short blocks. Like, they're not, it wouldn't be a long walk, but he was trying to go to the meat shop 2 blocks from my house, and he couldn't do it. And I can imagine his frustration. I can imagine how he feels, because he's always been the breadwinner and the support of the house, and he feels not only physically he is not doing well, he feels like a burden to our family. And I feel that that's affecting him as a human being. Wow. Like, I think that he is actually in depression right now. I'm not a doctor, but I can see the sadness in his face and like the frustration that not him or any of us can recover ourselves, haven't recovered ourselves to 100%. So it's still a battle. 3 months after, we're still like battling with everything.
That's the part of the story we don't get to hear very often. And I know all of you seem to share that. Ingrid, you said you just went back to work 2 weeks ago. You were released from the hospital on December 24th. It was a Christmas miracle that we were so happy to report on. You know, take us back to what it was like then on Christmas Eve, and the emotion, but also, you know, the road to recovery. It's a long one.
Yeah, you know, and that's what I had all my family too with COVID, so it was a concern as well. My daughter had COVID, my 2 daughters had COVID, my mom, my dad, and that's who's going to take care of me, you know? So my older daughter stepped up to the plate, and it's the same thing, you know. Every day I kept on, my mom and my dad didn't even know that I was intubated. They couldn't even, my sister couldn't tell them that, because they were battling COVID as well. And she thought by telling them this, it would just get it worse. So when I got home, my mom's like, oh, hi, because she thought I was just going to the hospital to get better. You know, like, it was just a thing because I needed to get oxygen. And she's like, oh, hi, I'm happy you're home. And like, now that she knows about it and knows that I could have not make it, then it's a different story, you know. She doesn't even want to talk about it because it's so emotional. But we were not able to tell them because they were fighting COVID too. So, you know, but just me getting home, I wanted to be home, and I put to myself, I need to get better, and I need to make that effort, because it was my daughter, my 18-year-old, having to take care of me, you know. So I needed to get better earlier, because now it's like Willema said, we get up every morning and I'm, Mom, how's your pressure? Dad, are you okay?
Yeah.
You know, kids, are you good? Are we good for the day? You know, like, and then we come back at lunch and I'm like, we good? We need to take our pressure. We need to take our saturation. The oximeter is part of us now, you know.
Well,
so
I
it's
can
a
see you're
life
doing much better too, because the last time we spoke, what was it, January, February, you were still using oxygen and you would run out of breath mid-sentence. So definitely, tell me, I mean, how are you feeling today?
Okay, I still have that post-COVID. No oxygen is great news. I have more energy, but I still get fatigued. I mean, I'm come to work, but I have a great staff. They take care of me. They're like, you don't eat, you need to go home and eat, you know? So when I go for lunch, then I take a breather, I relax a little and come back to work. So I am not overdoing it because I know that my body can't take it, not right now, you know? But I need to get out. I need to continue living. I need to continue doing my daily stuff that I used to do. But yes, I get backaches. I still get fatigue if I do it. I mean, my body was not doing anything for a whole 3 months. So just getting out and walking is a big thing. You do get tired. My pressure tends to go up and down every day, you know. But
let me ask a question here to all of you. You just give me a very quick response. How many of you feel that you're back to 100% of your prior self, your pre-COVID self? Anybody?
No.
No. Wow. That's very telling. We're running so quickly out of time, and there's so much more I want to hear from you. But let's close it off with one of the big moments right now. Willema, you got your vaccination yesterday, I was told, as a teacher. Let's talk about that moment, what it feels like now to be in this phase of the pandemic as survivors. We'll start with you, Willema, because you have your experience.
Marlene, my hopes were all came down. I got the call because Lady Bowen submitted all the names of the staff. I showed up to the clinic, and when I got there and they saw my paperwork and everything, the doctor came to me and he said, so you experienced COVID? And I said, yes. How long ago? And he said, and I told him 3 months. And he goes, sorry, I can't give it to you yet. So I was all excited. I was really excited about it, but I was asked to wait for 3 more months.
Okay.
Especially because I too, like my son, have ulcerative colitis and I'm on immunosuppressants. He prefers that, and he asked me if I feel like I've had a full recovery, I had to be honest.
So you have to wait 3 more months. But what does it feel like to see people around you getting vaccinated?
Well, I am so grateful that, for instance, all our staff at the Island Academy in San Pedro, they all are vaccinated. And it's almost, Marlene, like, you just feel safe. Like, it's just a feeling of, okay, I'm going to be working with people that are already have taken their vaccine, and so they have some immunity and they need their booster, yes, and we're going to make sure that they get it. But it just makes the whole environment at the Island Academy. We have still not, this Friday will be the first time that we meet as a staff, and I think that we're able to do that because we're no longer scared of where have the teachers been or
all right.
Well, they get in contact with. So it just gives you like this feeling of comfort and safety.
Similar thoughts? Are there similar thoughts from the rest of the panel, just to be at the phase of vaccination when you see those, when you saw those vaccines arrive in country, when you see the shots going into arms? What's it like as a survivor to see this taking place?
Marlene, we need to thank the government for bringing the vaccine so quick to Belize now, because many countries around us, they're still battling to get the vaccine. No? I encourage every Belizean to be vaccinated, Marlene. I don't wish any person to get this disease because it's very horrible and it's mentally deteriorates you as a person. So Belizeans, don't be afraid. Take the vaccine. You will not regret it.
Yeah. Yeah.
And I also want to thank all the frontline workers, the doctors, the nurses, the people that do the lab tests. They have sacrificed so many for Belize.
Yeah.
Let's give them a thanks and let's pray for them.
Yeah. That's right. Thank you so much for that. That's a great point to close off with. Jorge and Ingrid, your feelings about being at vaccination point?
Oh, I was happy when I saw that video. I had to share it, Marlene, I had to share it on my Facebook and just let it out, because it was a feeling of excitement and happiness, and I am waiting as well. As soon as I will be able to get it, I'm going to be able to get it, me and my family. It is something that we should get. I mean, I think what Mr. Orlando said, let's go out and get it. We need to get back to the norm, and that this is the only way, I believe, to move forward, but yes, I was excited and I just had to spread it all over and share it, because I was happy.
Yeah, absolutely. Jorge?
My case is that when the time comes for me, then I will be able to get it. We are not candidates as yet, but there's one thing I would like to say to all our fellow Belizeans: don't listen to rumors. There's a lot of negative sayings going out there. Take the vaccine, please. That's the only way we are going to get back on track. The vaccine is here. Don't listen to rumors. Please take the vaccine. It is free of cost. Let's get back our country and start to normalize back so that we get back to our normal lives.
All right. Well, I want to say thank you to all of you for joining us this morning. It has been incredible to hear your stories of survival. As we mentioned, we know that over 300 people did not get the opportunity to complete this year due to COVID-19, but so many others have fought and survived, and we appreciate you sharing your story with us. The emotional toll, the physical toll, and we wish you the speediest recovery so you guys can get back to 100% sooner rather than later. Thank you.
Thank you
very much for having me.
Thank you.
All right. And as our panel noted, one of the key elements in being able to survive COVID, in being able to get us through this pandemic time, it's our frontline personnel. And so when we come back, we are going to be talking to 3 medical specialists about what it was like for them, being the frontline persons trying to treat people with an unknown disease in this pandemic. So that's coming up as we go to after the break. And as we go to the break, we do encourage you at home, take a moment, say a prayer, a moment of silence for those that we have lost to COVID-19.
This COVID update was brought to you by Foltech Systems, your technology center, where you'll come for the price, but stay for the service. Working off-site doesn't mean you have to be off your game. Studies have shown that simply adding a keyboard and mouse to your laptop increases productivity by 26%. Add a monitor and you'll be 35% more productive. At Fulltech Systems, we have what you need to enhance your remote work or e-learning experience. With devices such as headsets, video conferencing monitors, webcams, keyboards, mice, docking stations, all with the brands you trust. Keep connected with collaboration tools like Microsoft 365 Suite and Kaspersky and perform efficiently no matter where you are. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
Over 3 decades ago, a Belizean company with roots in Toledo realized that Belizeans were paying far too much for life-saving oxygen. This concerned them greatly, and they decided to do something about it. Although Fabregas Belize Limited was born decades ago, that founding spirit of service to the Belizean people has not only been retained, but cemented into the fabric of how the company does business. Right before the worldwide pandemic began, Fabregas Belize Limited invested significant resources in improved storage and logistics for our country's life-saving oxygen. At the company's own expense, COVID-19 units in 2 of the 4 regions of the country received state-of-the-art specialized oxygen distribution infrastructure for in-hospital and direct-to-bedside oxygen provision. Today, our nation's premier tertiary referral hospital, the Carl Huchner Memorial Hospital in Belize City, is equipped with an ample, modern and suitable oxygen distribution system for its most pressing needs, even at the height of hospitalization due to the COVID-19. This investment in Belize's preparedness has ensured that throughout 2020 and now in 2021, Belize has backup reserves of approximately 300% more than the national need for life-saving medical oxygen. This important investment in infrastructure and technology is backed by a proud all-Belizean management and staff. Continuous training and adherence to international standards means that Fabregas stands ready to deliver the best products and service to its customers. So regardless of how Fabregas serves our nation, whether it's through providing the gases, technology and products that build Belize, or whether we serve by always ensuring that you, your loved ones and every Belizean home or in a hospital always has access to life-saving oxygen, Fabregas has got your back. And together, we look forward to rebuilding this nation in a post-pandemic world. Fabregas Belize Limited, we got your back.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
Currently, we're using Smart Elite VoIP calling plan. We use it interbranch, we use it to call outside, and we also use it to call international. It's far cheaper than what we used to have before. Our equipment are new, PBX box is new. So the PBX is very good because I can call to my Sartaneja branch, I can call to my Kikaka branch, I can call to San Pedro branch, and there's no cost using the PBS. Actually right now, since we're in different locations, I can call main office from where I am at a no cost using the PBX system. I would recommend it, sure I would, especially the big enterprises who has a lot of employees. There's a lot of reduction in costs, 50% of saving. But that on a year, it's a lot of money that we're saving. Money that we could return to our members, since we give back dividend to our members.
Visit our showroom or call 670-6710 to find out how Smart's corporate plan and PBX systems can benefit your business. Consultation is free.
If we are only as strong as our families,
businesses, institutions, and the communities that surround us. Then by giving businesses the power to grow, entrepreneurs the ability to expand, and by giving our families the right to own something. The Belize Bank gives you the power to build a nation, our nation. We are stronger together. The Belize Bank, our country, your bank.
The virus that causes COVID-19 may be spreading in our community. People might have the disease even if they have no symptoms at all, even when they look healthy. Because the virus needs us to spread from one person to another, we can stop it from infecting others if we practice physical distancing. That means stay at least 6 feet away from other persons. Don't shake hands or exchange hugs. Do not gather in groups. Stay home if government officials tell you to do so. Use social media or telephone to communicate. Avoid crowded and enclosed spaces. Work from home if you can. Stay home if you are sick, except to get medical care. Avoid close contact with sick people. Don't visit anyone who's sick in quarantine or in isolation. Give them a call instead. Help keep Belize safe.
And we're back, and if you're joining us now, we're getting our second conversation started. Of course, we are commemorating 1 year into the COVID-19 pandemic, since life as we knew it for all of us has changed. And we started off our conversation talking about survivors persons who survived the COVID-19. But undoubtedly, while life has changed for them, it also changed for the frontline workers who were dealing with a lot of these patients. And so we are going to be now joined by a panel of doctors who were on the front lines, and we have Dr. Pedro Arriaga, who is the head of the intensive care unit at the KHMH. We have Dr. Fernando Cuellar, who is an internist at the Belize Medical Associates, as well as Dr. Jorge Hidalgo, who is an internist at Belize Healthcare Partners. Good morning.
Good morning.
Good morning. Good morning, Thank you for having us.
Well, gentlemen, you know, in Belize, we say what? Your ears the ring, because we just finished a conversation with people who were hospitalized and survived COVID, and each one took time to call out each one of you individually as you had administered care to them as they faced severe COVID. 1 year later, can you even remember kind of the thoughts or feelings as we had the first reported case a year ago?
Yes, Marlene, let me go first. I think I'm one of the biggest mouth. First, I'd like to start by expressing our condolences to those 316 families that have been affected, and their outcome was devastating, meaning that we have had 316 people dying from COVID directly. Second, my thanks to the same survivors that you had on just a while ago. I'm very thankful to them for sharing their experience. Hopefully it will help Belizeans understand a bit better how serious and bad this condition has been. And personally, I'm sure that my colleagues share this, that they are our greatest teachers. They are the ones who teaches us the most. They teach us more than the books and the articles and the symposiums and the CMEs, when we are actually taking care of them live and in vivo, no? And thanks to my fellow colleagues, Pedro and Jorge, we've always been friends. We worked at the same ICU in Kalushta, but definitely I would say that this past year has bonded us closer than ever. We've participated in each other's patient care. We've had, thanks to technology, we've had chats that we've participated in on a daily basis, morning and night. When we have these same patients that you talked about, we were taking care of them as a group. We also have participated in development of protocols, and we've tried to put science in the care of these patients. And back to your question, I would think that I felt a lot of perhaps uncertainty at the beginning, because this was a new beast, this was a new animal that we were dealing against. No? And indeed, the way we used to do things in the past, in intensive care, in ICU, in ventilation, it has changed quite a bit since COVID. We've learned what we know now, we did not know then. So I think at the beginning there was a lot of uncertainty and of what we were facing.
You know, a year ago, Dr. Arriaga, in that very first phase, here we are with a disease that we know so little about, and you got exposed, I think, within the first month or two, right?
Yes.
Yeah.
Actually, myself and Dr. Hidalgo were in quarantine for maybe a couple of weeks, at that time.
Yeah, yeah. Tell us what it was like for you a year ago.
Well, the thing is, as Dr. Carr was saying before, we were really concerned about the news that were coming from around the world about this new disease that was affecting patients from the respiratory point of view. And at that time, I remember by the middle of February, we were preparing ourselves, to start receiving patients. We had to do a lot of changes, especially because of the main referral center for the entire country was KHMH. And not only from the structural point of view, but we're trying to allocate information that Tony said before very well, that we try to share information as much as possible in such a way that we try to create, protocols to start treating this kind of patients. Kind of difficult because, as you well know, the disease, up to this point in time, we have no medication supposed to be effective enough to control the disease. And although we have some preliminary trial with some medication that seems to be working in some way, we are behind. And we will start doing tremendous amount of changes, trying to acquire equipment in such a way that people that's supposed to have the disease, they're supposed to be taking well care. We still have some issues from the technical point of view, technological point of view, financial point of view, especially the hospital. But hopefully maybe in the next few months we could have some changes in that way.
And Dr. Hidalgo, for you 1 year later, what are your thoughts and reflections?
Well, a year ago we was standing, as Dr. Arriaga and Dr. Cuellar already mentioned, with the uncertainty as what we are going to face, a new disease that we knew so little. But most importantly for us, in terms of leaders, we were seeing how one of the most strong healthcare systems was essentially overwhelmed and getting hit by this virus. Then essentially what we experienced, we was a little bit with fear as how our system are going to be handled a disease of that extent. No, I think so. Reflecting, we are blessed in Belize that the disease, despite that we have some definitely number of cases and we have overhit, it wasn't that bad as we were expecting. No, we are right now essentially happy. Having a honeymoon, I say, and I don't know. I'm saying that with caution, because of course, as we were discussing before, we are seeing our neighbor countries that their ICUs are overwhelmed. I was just talking with some colleagues in Guatemala yesterday, and they essentially thinking that they are facing a third wave of corona. And just having Easter too close, we also back again 1 year after, just asking to the people that continue doing what we are doing to protect ourselves, to also to protect our country, and also to make sure that we can continue the way we are, as well as also this is not only for the population, but as well as I think so the Ministry of Health, they are also taking the necessary precautions to prevent us to get in a new hit by a new wave.
Yeah, and that's.
And I was actually going to ask about that. Well, at least in the context of Belize, and I go back to probably what, and you can correct me if I'm wrong, but going back to one of the probably the worst points of the pandemic, and I think back to November, December of last year, and of course we had a lot of conversations with Dr. Cuellar, Dr. Hidalgo, when it seemed like things were the system was getting overwhelmed locally. So can you take us back to that moment and some of the low points of the pandemic here?
Well, to that particular point, Gavin, I think you referred perhaps back in November, when our healthcare system, both public and private, had been overwhelmed. It wasn't a matter of it was getting overwhelmed, it had already passed the overwhelm limit. And I can remember clearly a turning point where we had a meeting with all of us, and Arriaga being the one who was in the public setting mostly, express his concern and his worries and even his frustrations about the Kalusha being overwhelmed. And if you can recall, that's when I came out public, and I tried to convey to the nation, to the Belizean public, that we were at a bad spot. Remember, I said that people are going to die in the streets, and I took heat for that, good and bad. And unfortunately, there was a well-publicized case of I think it was a policeman who had died in the ambulance, and that I think resonated big in the community at large, and we were hoping that different strategies were to be put in place to curb that. Unfortunately, it happened that way, that different strategies were heeded too, as we were recommending. And December, January, February, we saw the curve slowly coming down, the number of cases coming down to the point now where we can breathe a sigh of relief temporarily. Not forgetting, of course, just like I said, that we need to continue our vigilance, our care, our face mask use. Be aware that around us, there's a lot of trouble happening in Guatemala, Mexico, and we should still be prepared for any eventuality like that. And this brings me to the point where I think that this past year has been bittersweet, but I think the best take-home message we can have is to do and I was talking to somebody from Ministry of Health, to do a post-mortem, to do a report, to do a reflection on the different strategies that work, what didn't work, so that we can learn from it. We can learn from it so that we are prepared for the next amount of cases, and of course the next big pandemic that will come down the road. No?
As so we've learned.
If anything that this has taught us is to be prepared for the next, not only in the healthcare system, but as a country as a whole. Absolutely. And I hope that we do that and we learn from it.
I want to get Dr. Arriaga's perspective here, because of course being at the Carl Hister Memorial Hospital, that's the institution that will always get the most attention. I mean, attention in terms of people are looking on and want to see what is going to be done there. Before we even reported our first case, there was already growing concern when you looked at the numbers we were seeing in Europe and in the United States, that even just the small percentage of our population that would have most likely required hospitalization would have overwhelmed the system. Tell us about, being able to prepare, knowing the realities on the ground of the institution, and still, as we don't get to report enough, the number of people who actually successfully receive treatment and be able to be released from the hospital as well.
Well, we are still concerned, because we, as Dr. Cuellar was saying before, and Dr. Hidalgo, we are not out of the hook, I think we need to be realistic. We are surrounded by countries that have COVID, like Guatemala and Central America and Mexico. And we are looking also with concern, the numbers supposed to be in Europe and Latin America, that we have a third wave. So it's not impossible that we will have a third wave maybe in the next few weeks or a few months. And we were really concerned at that time, and we still continue getting concerned because remember, by the end of April, we were having maybe like 18 cases, and we went up to like 12,000 cases just a few months ago. Yeah. We still have the same kind of, technical problems, structural problems in the hospital because we don't have enough space to allocate patients sometimes. And lack of human resources, this is one of the problems we have. And also, we have constrictions concerning, the medication that we're supposed to be available or have available for these patients. It has been a tremendous amount of effort from people that are supposed to be working at the COVID unit and the ICU of the hospital. Those are really the heroes of this country. Doctors and nurses that were at the front line taking care of these kind of patients. I believe that we still have to be concerned. And one of the things that I could say, maybe because Jorge and Tony is here, is that the good thing in general of this outbreak is that it helps us to unify the people working in the health system, especially us, the people that are supposed to be working in critical care, and also help us to unify the country as one voice for the response to this terrible disease. No?
Yeah. Let's talk for a second about the science of it. What we knew then about COVID-19 and what we know now. In the early years, in the early months, I should say, we thought, it was communicated that we were most likely dealing with a respiratory illness, that is some form of infection in the lungs. Tell us about your own process as you started to realize this is not just something that's affecting the lungs. We're seeing many of the things take place. And I'm sure you saw that in your very own patients in front of you.
Yes, well, as we at the beginning and a year ago, sitting and also sharing with you the information, we were saying at that point that we are facing a disease that we know so little, and also that we were essentially learning while we're seeing the cases and also sharing with colleagues, especially those that have the most cases, no? Yeah. And then, of course, now we know a little bit more, but of course, this virus is still giving us surprises. We're still learning. We have more knowledge and some experience that this essentially it allows to offer a better care. But as you know, we are still not having a medication that we can say this is the medicine that we will cure the coronavirus. Patients, essentially the treatment is still supported. We know now that the condition is going to affect not only the lungs, it's a systemic condition, and then we need to be careful because we can essentially see a patient with a different type of presentation, not only respiratory diseases. Of course, the respiratory problems are the most complicated ones, and that they start something that we call it a cascade of events that essentially ended with a multi-organ failure. No? But again, even that we have more knowledge, we still and there's still a lot to know down the road. I don't know what Dr. Arriaga and Dr. Cuellar think about.
Yes, going back to your exact question, Marlene, we know quite a bit more than we did a year ago, for sure. If we talk about the ventilation or putting people on a machine to help them breathe, even the timing of when we do that is different now than then. The way how we handle the machine to the patient, the different strategies we use to address the problem of oxygenation, of where your lungs fail and we need to help you get oxygen into your bloodstream. That's the way we do that now is different from what we would do back then, and the way how we would use the machine on other types of patients. The other things we've learned, of course, is the whole blood clotting thing surrounding COVID, the fact that it can affect your kidneys so easily and affect other organs so easily, and your guts, you affect your brains, everything. So it's not just, as you said, it's not just a lung problem, but it affects the whole body overall. And the use of medication that we've learned, for example, the steroids, we used to be much more hesitant to use steroids, but evidence now show that the use of steroids is helpful. The medicine we use for the virus itself, called remdesivir, is helpful. The use of plasma is helpful. And like Jorge said, there's not just one magic bullet. It takes a whole lot of different strategies together to help these patients. But we've learned, and we keep learning as it relates to the ICU. And outside of us, the intensive care specialists, and let me hurry say something before I forget. I think we should mention Dr. Bradley, who works a lot in the ICU unit, the nurses in all 3 institutions and all over the country, the other doctors in the country. Indeed, we have taken the lead, so to speak, but we have had a lot of interest and cooperation from the rest of the country to help us. The health officials, I leave it as that, health officials has improved. They have improved. They've helped us to get the medication. I won't go by names, but clearly they have played a role. And I hope that we can look at this and learn, so that we as a country, as the Ministry of Health, as the private sector, can take the good points and build on it, and take the bad points and discard them.
Well, I'm glad you said that, because it hasn't all been, it's a period of time where there's been a hyper focus on our healthcare system, which, let's be honest, was lacking pre-COVID. And I think that one of the areas that we were looking at resources that were available. I think Dr. Arriaga mentioned even just structural things, how much space you could actually hold. But then it was also ensuring that healthcare professionals were receiving their PPEs, that they were accessible to all. And also the key point here is we mustn't forget the lack of specialists that we had. There's a reason that your 3 names have been spoken about very often, because it's a specific skill for critical care, the ICU treatment that you've spoken about. And I know you had mentioned, if not in this conversation, in previous ones, you were training people in other districts how to properly intubate, how to intubate someone, how to care for someone in ICU, because that was one of the things that would happen with severe COVID-19. How do we take that lesson of the gaps that existed, and what are your hopes in being able to see them being addressed? How do you prioritize them? Let's start with you, Dr. Arriaga.
I believe, as I was saying before, that the concern continue, and especially because we have countries surrounding us and all over the world that they have a 3rd wave. And because we know that there is more technology that is showing that there is different kind of mutations and variants of the virus that tend to be more infectious and possibly more lethal. So we are not, from the technical point of view and the information point of view, we are not going down and trying to get relaxed. We'll continue the process of, academic training, through Dr. Hidalgo and Minister of Health and Dr. Cuellar, in such a way that we could try to improve the quality of the knowledge to the physicians that will be taking care of patients around the country. Again, it's a bit concerned the fact that we have new information. There's a new disease that has been, in our experience, has been growing for the past 1 year.
Yeah.
Very much, in front of us, talking about new technology like the availability of vaccines and what we could do with patients and maybe medications in the future. But I think, again, although we have a honeymoon phase, like Dr. Hidalgo is saying, so we are not relaxing. We are trying to keep our hands up, in such a way that we could try to defend ourselves as much as possible in the future.
Yeah, yeah. And for you, Dr. Hidalgo?
Well, as Dr. Arriaga and Dr. Cuellar been saying, this has been a learning process from all of us. I believe the part of the learning process is that we've been able to collaborate, not only the three of us, and as Dr. Cuellar said, we essentially get a lot together to discuss several things, but also we have the opportunity to link with our colleagues in the districts and learn from each other. We don't know everything, and it was a good opportunity to also learn from our different colleagues. And one of the things I want to say is that just a year ago we started, Dr. Arriaga, Dr. Cuellar, and Dr. Espada with the idea to how we can keep the continual medical education and to bring people from abroad to share. And then we start with a continual medical education program that we planning for a week, and it was so successful that we have this program almost for a year. We will get our anniversary of continual medical education Belize just in a week, and that's just to mention and to say how the continual medical education program is so important, not only for the country, and we have the opportunity to share with ourselves and also with the international colleagues and got their experiences as how to manage COVID-19.
That's an anniversary that will be worth celebrating, that kind of collaboration amongst health professionals, both from urban centers to other parts of the country, but also internationally as well, as I know there's kind of been that collaborative spirit. Gentlemen, it is not, we haven't missed one of the key messages that I hear from each of you, which is, it is not over yet. We must pay attention to what's happening around us, and we must be sober enough to realize that that is still a potential threat for us. How do we put that into context for people? When we see 52 active cases, less than 10 new active cases, and a rollout of a vaccination schedule. If you were talking, and you are talking to the wider public, how do you keep them alert and aware of maintaining everything that we've been asked to do for the past year?
Well, I think, Marlene, it's discussion like this that will make it be on the front burner all the time, on the table, in the discussions, repeated over and over. Keep telling people, the media, the news, that yes, thankfully our numbers are down, but it can come up at any time. In spite of having the vaccines now, we still need to practice the three simple things that we've learned so well. All of us have actually earned a master's degree in how to use masks and how to hand wash and how to
keep distance,
physical distance from each other. And also we do need to keep pounding that in the general population for us to keep our numbers very decent. I do want to go back to that point that you mentioned about the preparation. We need to prepare our human resources. Now, it's not just about the ICU specialists, the ICU nurses, the lab tech. It's a whole revamping that we need to do in our healthcare industry nationwide to help us prepare for the next pandemic. We need infectious disease specialists. We need public health specialists. We need epidemiologists. We need all of these things that we need to sit down. And it's not just a hope. I would use strong words. It's a demand that we held our officials accountable for us to develop these human resources And please don't look at me and tell we don't have money, because that always one cap out. No? We don't got money for do this, and we don't got money for that. We got money for do other things when it suits us. But these things, like I said, we need to demand, and we will play our part as healthcare givers, so that we can prepare ourselves well for the other next surges or the next pandemic.
And speaking of the vaccine, I think that that's also a crucial point of discussion now that we're here a year later. Perhaps you can describe what it felt like when we all saw that the first doses of vaccines arrived in the country, and then we started seeing pictures and videos of people getting vaccinated. So what did that mean for you all as doctors, having experienced all that you did over the past year?
I think so. That's a very important step. Because as you mentioned, and we know that the vaccine is not going to essentially keep us away of having COVID-19, but it will definitely offer an opportunity to control the pandemic. And also, vaccines have been discussing and is also a fear. But I think so. Vaccines is an important step for not only for our country, but for the world to contain that pandemic. We personally get our vaccines, and we encourage people to get vaccinated. And this is the message. It's a year ago we was fearing and we was hoping to have a vaccine. Now we have the vaccine, and it's our time to play our role and get vaccinated.
And there are some ongoing. There's lots of research going on in all aspects of this pandemic, but one is looking at the impact of what this may have on healthcare workers. Dr. Arriaga, I believe the CEO spoke of mental health services being needed for your team there at KHMH because it does get overwhelming. Can you explain to us just the why this has such an effect on the team there, so people can understand the amount of work that you all have put in?
Well, you can understand, generally speaking, that when you're dealing with a disease that we don't know where we're going, that there's high rates of infection and certain degree of lethality, we need to understand that. And again, just to emphasize the fact that 80% of the patients that had the disease, they will have mild to moderate disease. Only 20% kind of patient has severe disease, and maybe 1 to 5% that have maybe critical disease was supposed to be in need of some type of ventilation. But the fact that healthcare workers, nurses and doctors, they are working under pressure, using PPEs and some kind of equipment that make sometimes the movement very clumsy. And all the possibility of contamination is extremely difficult. Sometimes, at some point in time in the pandemic and the outbreak, we have our healthcare workers separated, and they were quarantined, and this causes more stress, being out of the family and have no contact with the regular, routine, and also being swabbed, very often. So the fact that there have been long nights, with patients that are really, really sick, because our patients that they were at the hospital, they were extremely sick, with serious respiratory diseases, a variety of conditions where you have strokes, you have heart attacks, kidney disease, and some more problems, so it makes the situation more difficult for doctors and nurses. This is not only KHMH, but around the country.
Yeah.
And the other thing is that they are unexpected. We don't know what we were expecting when we were seeing a patient there, because the disease could be behaving completely different from person to person. And some people that they were thinking that everything was okay, then they finish, having serious problems. And patients have serious problems that they survive. So a lot of things that we're supposed to be getting to know with time and experience with the disease. But the amount of stress and amount of, demands, from very sick people that were in the hospital at that point in time, with a certain degree, the limitations from the technical and structural point of view, put an extra amount of stress and separation from families. Although being patient is supposed to be very sick, and separation with their families also put a lot of stress on us.
Yeah.
But I think, in some way the hospital also started, trying to make an effort to create, counseling booths in the center in such a way that people that are supposed to have something in the street could be able to get some counseling.
Are we better equipped today, we believe, to treat severe COVID-19 and have people survive if they're hospitalized?
Yes. We have more knowledge, we have experience now, we have more technology, we don't have enough, we will never have enough. We know how to ventilate patients differently. We have medication, remdesivir, the dexamethasone, the blood thinners, plasma. So we have, compared to where we were a year ago, we definitely have more than before. Nevertheless, each COVID patient seriously ill still will prove a challenge, no? So we should still go into battle with all of these resources that we have, but still feel like we're up against a giant of a disease.
And we got the vaccines, Tony, and all those things. Well, we have vaccines to make it.
Let me hurry say the vaccines, all the vaccines have proven that they stop the progression to severe illness and they prevent deaths. They might not prevent you from getting a sick thing, but it has shown all the vaccine conclusively. And that is important for people to understand and believe, that it stops the progression. It not make you get that sick then, it not make you have to be hospitalized. And it definitely, people who have been vaccinated, the risk of them dying from COVID is next to none. So that is very important. That's the end point. That's what we want to achieve, that people don't get that sick that they need to be in the ICU and have wake and eat Johnny cake and drink coffee, so it prevents deaths.
Yeah. We couldn't even have wake in the past year because of the pandemic. But what worries you the most, or what are your concerns moving into year 2 of the pandemic for COVID-19?
My concern, personally, and I believe Dr. Arriaga and Dr. Cuellar will agree, is this period that I call it the honeymoon. Mm-hmm. Because it's a period that everybody feels like, that we are essentially get over of COVID, and this type of relaxation we need to take it very, very with a lot of caution, because we don't know what is going to happen in the following weeks. I mean that I think so. We need to take this time that we have the COVID is give us to prepare and to be ready, and hopefully we don't need to face another wave. But if it is the case, we need to be more. We will be ready. Also, an important message for the population is: don't wait to get very ill to look at medical attention. As soon you feel that you have some symptom, please get in touch with your family physician and get attention as soon as possible. Don't wait until you are really bad, but then, because it's going to be very difficult for us to help you. And also, several people get to COVID-19 in many ways. And again, as Dr. Arriaga mentioned, each case is different. Yeah. What it works for my neighbor is not going to work for me. Yeah. And then, please, if you are ill, seek medical attention.
Yeah. And just very, very quickly, so we don't lose the opportunity to say it, for those of us who have had the first dose of the vaccine, we are not protected as yet.
That is correct.
Yeah.
We need to get the second doses of the vaccine, and even though with the second doses of the vaccine, as all of us are stressing, we need to continue practicing the social distance measure.
Yeah, yeah. And just before we wrap up, one of the things that we haven't started discussing yet, and I think that the first panel really brought to light, is the long-term effects of COVID. What will year 2 show? Are you thinking of what year 2 will show us of the residual effects of people who get COVID-19?
Well, we have that we call it, and I believe the three of us have been seeing, and also our colleagues in the districts have been seeing, that we call it the post-COVID syndrome. And the post-COVID syndrome is manifest in many ways. Most of the time we have the post-COVID lung that essentially cause a lot of limitation to people, and also the mental stress, the nightmares, and many other symptoms. But I will give time to my colleagues to also mention what has been the experience from them. But that's some of the things that I personally I've been seeing.
Yeah, that is so true, Jorge. We are seeing a lot of the post-COVID syndrome. We have different symptoms that we are not we don't fully understand yet why we can't explain them. I think one of the most common symptoms is fatigue, just a sense of tiredness. We still have some people with short of breath, with cough, with general malaise, with the feeling that they have not recovered fully. And I think that's something that we're going to see for the rest of the year and the years to come. And it's not only us in Belize, it's worldwide. I mean, this has been a new disease, so the after effects of the disease is still being discovered as we go along. But I do want to highlight what Jorge said about what is our fear. Our fear is that people start to chill out, relax too much. I don't know why Jorge used the word honeymoon. Honeymoon wasn't good for all of us. It doesn't mean the same, but this time of chill and lull can prove to be dangerous, because then people let down their guard, and then we get into a third wave. I'm worried, for example, next week, Easter to come, we want to gather on the beaches. I hope people remember that they still cannot do that or should not do that, to have big gatherings and practice the same things that we've been practicing. And I hope our officials, the police, the healthcare officials, everybody, the hotel people, everybody do the right thing and keep their guard up. And please, everybody, go get vaccinated when your time comes.
Yeah. Get vaccinated, wear your mask, wash your hands, social distance. These are all things that we still must maintain. You know, this was only a short opportunity to be able to acknowledge from the healthcare point of view just what this year has been like. And it would be, we of course have to acknowledge that we did lose healthcare workers along the way as well. Of course, Dr. Guerra's, the Guerra brothers that we lost to COVID-19 as well was really one of the low points in the pandemic in the past year. And just before we close, to be able to acknowledge all healthcare workers, from the attendants to the nurses to the people who maintain the cleanliness of the rooms. I'll leave you guys, because you know the full staff, and compliment Dr. Arriaga. Maybe you can shed some light on that. But it takes a whole dedicated team to have provide the care that you all have done in the past year and will continue to do moving forward.
Well, if I could say something else, it's that, again, I'm so grateful to all people supposed to be working with our patients in the COVID unit and the different ICUs with Dr. Hidalgo and Dr. Guerra. We could be, can't say thanks enough for these people. They risked their lives, you know, and they were so courageous to be, you know, on the front line, you know, all the time. And even with long hours, night hours, you know, frustrations and limitations and everything. Doctors and nurses, you know, working around the country, you know, in the districts, you know, and doctors are supposed to be working there with more limitation than what we have in the city. So those are the real heroes, you know, of this outbreak, you know. People are supposed to be risking their lives and trying to do their best to make people survive. And as Dr. Cuellar said before, you know, and Dr. Hidalgo too, that remember only more or less 4% of the population get the first dosage of the vaccination. So we got to wait at least 8 weeks time to get the second dose. And after that, as Marlene said, we had to wait a couple of weeks to get the maximum protection for the vaccine. So it's critical for us to continue trying to work, as a community globally in such a way that we could move to have the most people vaccinated in such a way that, as Dr. Hidalgo and Dr. Pierre said before, we have more mild and more disease, and when we have severe disease and more people ventilated, they are dying with us.
Yeah. If I can say something concerning the people and the medical colleagues that we lost. We lost the two colleagues that essentially they was just starting a very beautiful career, but also we have Dr. Baldomiro Barbosa, that he essentially was a pioneer of medical, especially in internal medicine in Belize. And I just don't want to forget to mention his name and also all the contribution that Dr. Baldomiro did for the country of Belize. I want just to don't forget, I don't want to forget Dr. Barbosa and all he did.
Well, thank you very much for that reminder, and of course to the 316 families today who grieved the loss of their loved ones that didn't survive the first year of the pandemic. But we want to take a moment to say thank you to you three who've been so vocal and upfront. You've helped us to explain the science behind this medicine nonstop. I know that you probably got exhausted from hearing from all of us, but we do hear your message. This is not over yet. We must continue doing our part. We, the media, and we, every single citizen, in maintaining the safety protocols. Thank you, gentlemen. Continue to stay safe, and we appreciate you and all healthcare workers across the country.
Thank you, Marlene. Thank you, Gavin.
Thank you. Thank you, guys. Stay safe. Bye-bye.
Stay safe. And with that, we're going to go ahead and take a break, and when we come back, we'll wrap up. So stay tuned.
Set in place by the Center of Disease Control and Prevention. Passengers traveling to the U.S. must present a negative COVID test or a documentation of having recovered from COVID-19 to travel to the U.S. In light of this, Maya, in partnership with Caring Hands Clinic, have established testing centers in all their municipal airports. Caring Hands Antigen Test Center is operational in San Pedro, Belize City, Dangrega, Placencia, and Hopkins. These testing facilities are staffed by licensed healthcare professionals, including doctors, registered nurses, and nurse practitioners. Testing is done using Abbott Rapid Test devices that are FDA approved and made in the USA. The service is safe, fast, affordable, and the close proximity of the centers makes them convenient. Walk-ins are welcomed, but appointments are encouraged. If you would like to make an appointment, please feel free to do so at Make your appointment, get tested, and in 15 minutes, you can get back to your vacation.
Hola, Tony.
Hey, Kevin, ¿qué onda? ¿Qué pasa?
Nada, le vine a buscar porque necesito comprar más mercancías de vasos y platos desechables para mi tienda de comestible. Me estoy quedando sin esas cosas.
No, hombre, fíjate que desde el 15 de abril no puedo importar nada de eso. Y se me acaba de terminar todo lo que tenía hace como 3 semanas.
Oye, pero nunca has estado sin esas cosas. ¿Qué está pasando?
Mira esto. Esa es la nueva ley que prohíbe todo el uso de plásticos no reutilizables. Esos son vasos, platos, cucharas, tenedores, todo eso. Desde 15 de abril de este año no he podido importar nada de eso. A partir del 15 de enero del 2021 nadie puede fabricarlo. 15 de abril 2021 nadie lo puede vender. Y a partir del 14 de julio del 2021, si alguien te agarra con eso, te multan.
Híjole, no sabía eso. Necesito cambiar algunas cosas. Les diré a mis clientes por qué esas cosas ya no están disponibles. Gracias, Antonio.
Así es, cuídate.
If we are only as strong as our families, businesses, institutions, and the communities that surround us, then by giving businesses the power to grow, entrepreneurs the ability to expand, and by giving our families the right to own something, the Belize Bank gives you the power to build a nation, our nation. We are stronger together. The Belize Bank, our country, your bank.
It's a fact that you can access unlimited services with Smart. Tired of being measured or cut off when you need to be connected? It's a fact that when you sign up for Smart's Plus plan, you get unlimited talk, text, and unlimited data. And it's a fact that you can sign up with your group of up to 5 members for Smart's Share plans and up to 40 members for Smart's Enterprise plans for unlimited talk, text, and data. Smart has the true unlimited plans. That's a fact. Be smart and live smart.
It's been a year of lockdowns, losses, and separation from loved ones. As life slowly begins to return to normal, Channel 5 invites you and your family to join us on TV, Facebook, or YouTube for a News 5 special report from panic to pandemic. COVID-19 a year later, we look back at the people, the events, and the struggle Belizeans will never forget. Thursday, March 25th at 8 p.m. right here on Channel 5.
And we're back. And we are just wrapping up our show this morning. And if you've been watching, of course, we have been commemorating 1 year of COVID-19 in Belize. And it seems, I don't know for you, Marlene, how it feels to you, whether it's gone. At times, it feels like time has been moving so slow. But now that we've already made it to a year, it feels like things have gone so fast.
Yeah.
And of course, when we consider all the conversations that we had this morning and we put them in context, it really has been a roller coaster. And I'm imagine that, you know, that those words don't even come close to describing what it must have been like to have experienced or to have lost a loved one or to have seen somebody close to you that was suffering with a severe case of COVID-19. Yeah. So the first part of our show, we were speaking with survivors, and all of them actually were, not only did they survive, but they had immediate family members who had either serious cases or they lost their lives or, you know, they had to manage that. So yeah. The first part of the conversation was certainly very illuminating. Yeah. And, you know, it brought the reality of it home, you know, hearing these experiences that they lived through.
Absolutely. And we want to say thank you to our panelists this morning for talking about their stories and sharing it with our viewers. Today was a day to be able to acknowledge that we are 1 year into the pandemic, but most importantly, as the second panel reminded us, we're not out of the pandemic as yet. And as we talk about vaccination and as we talk about what we now know about COVID-19 versus what we knew a year ago, one thing we know for sure, we know how to protect ourselves. We know that keeping distance, wearing a mask, washing your hands, and of course, getting vaccinated when it is your turn. These are the things that are going to help us keep the disease at bay, keep the numbers low, so that we can keep our loved ones safe. It is also really important that what they discussed, that countries right around us are facing what is a third wave. There are countries, I know in Europe, they're looking at lockdowns again. Jamaica is doing some pretty rigid stuff with their curfew over Easter. Guatemala is seeing a surge in cases. In South America, there's the same. So it is not done, and we have to be cognizant of that. So as we move around each day, please remember that COVID-19 is still very much a reality, and that even if you've gotten your first vaccine, you're not fully protected yet. So you have to continue wearing your mask and doing everything that you should.
Yes, absolutely. And of course, as Marlene said, it's not a time to let our guards down, especially if we know that we want life to come back to normal, but that will only happen if we all do our part. And that starts with just ensuring that you do adhere to all the safety protocols and measures to keep you and your loved ones safe.
That's right.
Yep. But of course, that is just about all the time we have for today. So if you want to contact us, you can send us an email at oie@channel5belize.com. You can also find us on Facebook at Open Your Eyes BZ and on Instagram at OIE Belize.
And remember to tune in tomorrow morning at 6:30 when you open your eyes.
Start your morning right.
Until then, keep your eyes, your mind,
and your heart open.
All right, thank you so much for tuning in. We want to encourage you to continue to stay safe, and we close today remembering the lives that we've lost during this pandemic. Please stay safe, and of course, say a special prayer for them as well.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.